Well, I think we're going to go ahead and get going, guys. Thanks so much for joining us tonight. We have Bettina Newman, myself, Mike Munsell here based out of Seattle, and Dr. Cheryl Burdett, one of our board members, and, good friend, Cheryl Imogen. She does a lot of lecturing for us, and she spoke at our experience just a few weeks ago. Actually got a standing ovation after her talk. It was so well received. So I know tonight you're going to get a lot of great information, and Dr. Burdett is a naturopath out of Bastyr University. She did her rotation residency program at Cancer Treatment Centers of America and currently practices at Progressive Medical Center in Atlanta, Georgia. She's co-owner of a laboratory. Is a busy clinician and a great person. So, Cheryl, go ahead and take it away.
Thank you for such the warm introduction. And for those of you that got to be at the experience, we're going to recap a little bit there, but with some more information, because after I was there, I just come back so intellectually and emotionally energized, and it just jazzes me up for practice and everything that we do. And I know I say this often, but it's always true, the affirmation of hanging out with doctors that are amazing as the people that I meet through Zymogen, and the stories that you get to hear over and over about how we've made changes, helped people to fundamentally change their life, to adapt good lifestyle choices, to give them tools that help them to get to a place where they can make better diet changes, make better health choices, and ultimately be able to express themselves more fully is just so affirming. And so tonight's talk goes right into that vein for me, because many of us in the community of functional medicine are experts at treating the gut. And this is an area that is near and dear to our hearts. And what I love about this area and this talk is that the research validates what we've been doing for years. And if we in some places, if we back up to yesterday at a doctor's office, but hopefully more if we back up 5 years or 10 years, and we think about when we went in and we said, well, I'm going to try to change these symptoms with diet, often that would get laughed out of the room. And the research comes around to really validate that what happens at a gut level is fundamental to the rest of our body. We've been saying for years that if you treat the gut, you'll feel better, your mood will be better, you'll have less depression, etc. And maybe there's been pushback at times where people have said, that's ridiculous. Treating the gut doesn't have anything to do with the brain. Treating the gut doesn't have anything to do with autoimmune conditions. But we've pushed forward with our ideas that if you change what's going on in the gut, that you can change somebody's health fundamentally, and the science catches up to the philosophy and really validates what we've been doing. And I think what's even more important than the validation and the affirmation is the tool that it gives us. And the tool that it gives us is these are not genetic conditions. Things like Crohn's, colitis, celiac, while there's a genetic predisposition, there's the environment that affects the genes. And so we're going to dig into that, and we're going to look at that story here on a gut level. The other thing I like about that really excites me about this talk is that, again, we're experts at a good part of what I'll call this triad here. Our community has really embraced the idea that foods, not only through IgE-mediated allergies, an immediate anaphylactic shock, shortness of breath, etc., but that foods mediated through histamine can also cause a host of symptoms. These are those IgG reactions. So we've recognized that there are multiple ways that our body can react to foods. Also, we as a community have recognized that unlike maybe a standard of care stool culture that looks at 3 to 4 organisms, that's not the whole story. And the story is the good flora. The story is the bad flora, the bacteria, the yeast, the parasites. And we've really come to recognize that foods and bugs can certainly be irritants to the gut lining. However, another piece of the story, and I liken this to toxicity. So, for example, we all know that part of the puzzle is toxic exposure or toxic body burden, but the other part of the puzzle is how well do your filters work? What is your liver like? How good are you at moving things out of the body? How good are you at having bowel movements and conjugating things and moving toxicity through the system? So it's two parts. It's a seesaw. Not only what is it are you exposed to, but how does your body deal with it? This gut story parallels that idea. It's not only the irritant you're exposed to, the bug or the food, but it's also your body's ability to deal with that. And that is the story of diamine oxidase, the enzyme that degrades histamine. Other countries are a little ahead of us on this. In European countries, Eastern European countries, histaminosis is recognized as a diagnosis, a full-fledged ICD-9 code. Here, we haven't quite embraced it and really given it the time and the effort that it merits. But it fits right into our story that treating the gut is paramount, and it gives us another tool to lower histamine, an endogenous toxin, somewhat like exogenous toxins, butyrate, solvents, etc. So it gives us one more tool to treat the gut, and a really good tool in those people that are even the most sensitive, some of the people that are hardest to work with. So what is DAO? That is the enzyme that degrades histamine. So again, there are two parts. There is how much exposure to foods or bugs are causing an irritant, but then how good are you at decreasing that irritant you're exposed to? That's your level of diamine oxidase. And so read the list of symptoms that you see here. If we have a lower activity of diamine oxidase, we get headaches, we get GI symptoms, we flush, we have diarrhea, all the same symptoms that you would think of with food allergies or even dysbiosis. So now, through looking at some of these biomarkers, we can have a lens into what part of the puzzle is off, and that guides us clinically to make a more specific treatment choice for that person in front of us. And then check out the bottom there too. Also, cancer of the colon as well. So from food allergies to colon cancer, an irritant is playing a role. I love this slide. I got this from Ryan Frace. He also spoke we spoke together at the Experience. And he put this up and he said, see, this simplifies everything. And he said that tongue in cheek. However, I thought it was a great overview of, again, an endogenous toxin, in this case histamine, and look around at how many places it affects. Yes, the GI system, but the immune system, the nervous system, cardiovascular, respiratory as well. And let's dig down a little more on this. So, for example, even things related to hormones. Look at histamine, increasing estrogen, having effects on the uterus, causing more dysmenorrhea. And they are over here in the respiratory tract. The histamine, we've always thought about bronchoconstriction, but we're going to also talk about this diamine oxidase and its relationship to something called zonulin, and how zonulin is also related to permeability not only in the GI tract, but the lungs as well. Central nervous system. So here is a bonus slide if you were at the Experience. This is not something I shared with you there. And this is a slide that reviews medications that inhibit diamine oxidase. And this list is not at all complete, because the research talks about over 100 different medications that can inhibit diamine oxidase. I found this interesting. Look at this table. Drop down near the end, let's see, near the bottom, antibiotics. We know that antibiotics are going to create a certain amount of GI distress, and so we are the experts in terms of giving probiotics maybe alongside, certainly afterwards, things like Saccharomyces to prevent antibiotic-induced diarrhea. But think about the implication here. Here we are giving an antibiotic to kill off an infection, and often what can limit the use of the antibiotic is the fact that someone can't tolerate it. They get sick. They have GI upset. So they don't make it to the end of the course of the antibiotic. They risk making something more resistant, and most importantly, they don't get the benefit of the therapy to clear an infection that could become a chronic infection, etc. So Again, it guides us clinically. When we have a patient on an antibiotic and they're having GI distress from that, of course we want to use our ProBio Plus and our Saccharomycin. But in addition to that, think diamine oxidase to offset some of that issue. I've started using this in chronic Lyme patients, for example, that we know that are going to have to maintain high levels of antibiotics long term, and this is making a difference in their ability to receive the therapy that sometimes almost is as bad as the condition itself. Now this is the one that really got my eyes rolling in the back of my head a little bit. Drop down a couple lines to H2 receptor antagonist, cimetidine or Tagamet. So I thought about the classic scenario where Tagamet would be used. Patient goes in, says, my stomach hurts. Doc says, you have gastritis. That could be too much hydrochloric acid. Let's give you Tagamet. You take the Tagamet, you block the enzymes, the HCl, but you're also now blocking diamine oxidase. So while you're on this, you're inhibiting the enzyme that breaks down histamine, and so we can see why it becomes difficult to get off these things. Later, I'm going to show you some research that actually Bettina shared with me that talks about these H2 blockers also increasing our risk of food sensitivities as well. So here you are taking a medication to make the stomach feel better. It inhibits diamine oxidase, and now there's more histamine, and it keeps you from breaking down proteins, so you become more allergenic, more IgG food sensitivities. I am not suggesting that this should not be used short term, but I think that that's probably the best way to use it as it's advised as a short-term therapy. And then stepping in and doing our good work, our ProBio Plus, our Saccharomyces, and our IgG 2000. I want to spend some time on the immunoglobulins tonight because I think they have a unique role to play in this leaky gut story. Here is a slide from Dr. Fasano. He's a researcher out of Italy, and he is the one that isolated a molecule called zonulin. It is fun to say, and it, again, is meaningful. So zonulin is a marker that goes up as tight junctions of the gut mucosal layer are broken down. It is a direct marker of leaky gut, but beyond being a direct marker of leaky gut, look at the left and the right hand of this slide. The left side is major diseases associated with zonulin, and we see autoimmune conditions, cancers, diseases of the nervous system. To the right, we see diseases associated with chromosome 16, where zonulin is. The same exact list. So he's building the story of the connection of leaky gut to, as we've talked about literally for decades, autoimmune conditions, cancers, and the nervous system. So this slide talks about a condition that we would have thought about being associated with histamine, eczema, being associated with low diamine oxidase. So again, it gives us another clinical tool to treat that. However, this the part of the background you can't see behind here, this slide also talked about not only eczema, but other things that we would think about as being histamine mediated and probably usually would think about being a food sensitivity, but could also be this low diamine oxidase. So other symptoms like that. So this piece of research talks about dysmenorrhea, headaches, bloating. And this fascinated me. So when do we see the most diamine oxidase? Well, we see it when a woman is pregnant. When we're pregnant, our levels of diamine oxidase skyrocket. And part of that is because the placenta produces more diamine oxidase. That makes perfect sense, right? It's trying to break down histamine so it doesn't get rejected as something foreign from our body, so that there is a symbiotic relationship there between mom and baby. This piece of research talks about low diamine oxidase in high-risk pregnancies. I'm not suggesting it as a treatment because I think certainly that's a huge, high-risk pregnancies are something that probably, we need to approach with a huge level of caution. However, I found it interesting conceptually because when there's low diamine oxidase, there's more high-risk pregnancies and more miscarriage. This also made me think about, what about our women that do so well during pregnancy? Have you had this when you take the history and they say, yeah, pregnancy was the best time of my life? Well, I've always been busy thinking estrogen dominance, you're pregnant, your progesterone goes up. Another time I think in that vein is How about headaches right before a period, or dysmenorrhea, or cramping, contraction of the uterus? We'll think back to that first slide that showed increased estrogen when we can't break down histamine, i.e. low diamine oxidase, and the research talks about that. As we approach our period, we have lower levels of diamine oxidase. Well, I've always thought as we approach our period, progesterone's dropping off to cause that lining to shed. Low progesterone is causing symptoms, and I don't think that that's wrong. We know that progesterone stops neurogenic edema or swelling of nerves in the head, so certainly low progesterone can cause headaches, and you'll see more migraines right before your period. But how about those people that have more cramps, that have more headaches, that have these issues that we associate with estrogen dominance? You give them progesterone, and it doesn't do anything for them, or it makes them worse. Well, maybe it's not the progesterone, maybe it's the low level of diamine oxidase, and again, this piece of research goes on to talk about better levels decreasing dysmenorrhea. And again, now, while I use lots of progesterone, I think for most of us, our goal is to use the least invasive therapy that's the most effective. And so, and let's use this for example. How about the 16-year-old girl who maybe comes in with PCOS, polycystic ovarian syndrome, and her testosterone is high and her progesterone is low and she's not having periods. And I don't have any problem using a bioidentical progesterone in that 16-year-old patient. Standard of care would be birth control pills or progestins. But how wholesome is it if we can start there and then work with our things like with our high-dose ALA, 600 milligrams, that has been shown to restore menses and dysmenorrheic women. If we can work with, and then also work with the gut so that they're producing better levels of diamine oxidase as well to solve these problems. So some people might need some level of diamine oxidase long-term. They could have polymorphisms or SNPs that would require to take some extra diamine oxidase so they can deal with the histamine load of the world. We're always going to be exposed to some histamine. There are low histamine diets, so these are much like your anti-migraine diets. These are less red, no red wine because of sulfites, and also red wine has high levels of histamine. This is no aged cheeses because as foods age, they produce more histamine. So it's pulling out those same sorts of foods that we pull out for migraines. So again, we're seeing some overlap there. But even as you do that, and as you treat the gut, we begin to produce more of our own diamine oxidase. It's made in the microvilli there. But some people might need to take some ongoing just because they have a polymorphism or an inability to make this like other people. We're going to look at a case study where I started off dosing of the diamine oxidase twice a day. A board member, when I was presenting this, said, well, Cheryl, why didn't you dose it one with each meal? And I said, good point. That sounds like a smarter way to dose it, actually, because now they're breaking down any histamine that's produced anytime they eat food. Here is a picture of food allergies. And so what we're seeing is the little dots up top represent histamine being produced from allergens from food, and the DAO, the diamine oxidase, neutralizes that. However, if it's not neutralized, that release of histamine from the mast cell in the middle can cause the tight junctions to degrade, that's up, or bronchoconstriction to the right. Look at the bottom, more vasodilation. Now think about your most hypotensive patients, those that I have always thought extreme adrenal fatigue, so low epi, low norepi, not sending the signal to the vessels to constrict like it should, so hypotensive, dizziness when they go from sitting to standing. And so as I started to think about these people with blood pressure in their 90s over 50s, what I also thought about them is they tend to be my more sensitive people, my more reactive people. And so I've been busy treating adrenals. I still think that's a valid approach, better epi and norepi, so better vasoconstriction, treating adrenals, better cortisol, so that will help lower the histamine burden. But I think in these patients we should think about lowering the histamine itself through diamine oxidase. And another way that we can do that besides giving diamine oxidase and or treating the gut so the gut makes more diamine oxidase is B6, so something like your Corticare. And the Corticare is the perfect formula for the adrenals, B5, B6, vitamin C. All of those build adrenal health. Some carnitine to stimulate the enzyme that helps to make more of the cortisol there. But that B6 is a cofactor that helps you make more diamine oxidase, as is the vitamin C in there. So I love the wisdom of natural therapies. Here I am giving B6 and vitamin C to help the adrenals to decrease cortisol. Unbeknownst to me, at the same time, I'm giving the cofactors that tell the body to produce more of its own diamine oxidase. That's why these things work, because they're epigenetic. And that's why the gut is so important. A statistic from the World Cancer Foundation talked about how from diet we get up to 25,000 different phytonutrient compounds a day. So think about what kind of either an assault on the gut that is, or such a cornucopia of nutrients to the gut that is, depending on the gut's ability to recognize that and be immune tolerant. It's mind-blowing. So some people have said diamine oxidase is only produced in the gut and you're only getting a local reaction there. The physiology says different. So what they have seen is that diamine oxidase gets taken up through intestinal lymphatics and is transported systemically. That's why we can do a blood draw and measure diamine oxidase. In addition to that, this piece of research talked about what helps it to be taken up even more, and it talked about fatty acids. I.e., so think fish oil. So when you're trying to maximize your antihistamine therapies and you're giving histoblock, the diamine oxidase, give the fish oil too. We know that that improves the membrane of the mast cell and decreases degranulation. So we'll decrease production of histamine and will increase degradation of histamine. And the fish oil works synergistically with the diamine oxidase to increase its absorption. So it's easy to remember. It's all the things that we need to do for allergies already. Here again, the fish oil plumps up the microvilli, and so now the microvilli can begin to make more of their own diamine oxidase. So I think back to the experience, and Ryan told a very touching story about a little girl that was so reactive to everything, even water bottles. There was some lubricant that when she would open the water bottle, she would react to. And the thing that was the game changer for her was the diamine oxidase. And she had to take 4 twice a day. But I don't find that I typically have to dose it that high. And in somebody like that little girl, where maybe you needed to ramp it up initially, when we do things to work on leaky gut, again, you improve the body's own ability to make diamine oxidase. When we give our fish oils, we plump up that microvilli, and we're decreasing things like, if you look to the second to the last line of this abstract, decreasing things like NF-kappa B, that way upstream pro-inflammatory mediator. This is a helpful clinical tool as well. So more nausea with Taxol in gastric cancer when diamine oxidase levels were low. So it's a therapy that we can use with that we can use alongside chemotherapy to reduce nausea. And this piece of research went on to talk about when nausea was reduced, body weight was maintained, and they had overall better outcomes than obviously those that were feeling super sick. And if you've ever looked at response curves to chemotherapy, what you see is that you don't begin to get the response from chemotherapy until you get almost all the way to the end of the regimen. So unfortunately, someone who has to quit chemotherapy half the way through, they didn't really get half the value. It's getting to the end of the therapy where that response curve really takes off. So anything that we can do to get them to the end of that therapy is critical for long-term outcomes. So this one talks again about headaches, and we mentioned that before, but I included this because it also includes that reference to other things that we can do to increase diamine oxidase, like the Corticare, the B6, and the vitamin C. So here's why we do what we do, because we can make such fundamental changes in people in such quality ways. So here's a patient who presents exactly like you would expect her to if she has problems with diamine oxidase. Chronic hives, gut issues, but worse than most, only maintained on prednisone. So here she is on prednisone, which will damage the adrenals, adrenal fatigue, less cortisol, means more inflammation, and it's just the speed forward into needing more and more prednisone to maintain. And it makes it harder and harder to get off of it. Consider DHEA alongside prednisone. Jonathan Wright did a small trial where he used 10 milligrams of DHEA alongside like a Metarol dose pack and found it to protect adrenal function. So always nice if people have to use that to protect. So here was her initial diamine oxidase, just tanked really low. And then look at the next one, histamine, cranked up to the right. We would expect this in someone who is having more GI issues and more hives. And so her ratio is low, not good. After only 2 weeks of therapy, look where diamine oxidase goes. And actually, it's probably shown a little better here. Diamine oxidase shoots up, but look at histamine. It's not long enough yet. The histamine hasn't come down, and so her ratio has improved, but she's not ready to back down the dose yet. So I can use this to tell me, yes, I need to keep her on some diamine oxidase, and yes, I need to still address what's causing the histamine and get her systems in place, the gut lining, the adrenals, so that she handles the load better. And then as the histamine starts to come down, this is a time that it makes more sense to first back down the prednisone, assuming the prescribing physician is in agreement with this, and then also to follow that with the DAO, and then finally back down the DAO as we've done things long-term, like build up the gut lining and build up the adrenal function. So the proof is in the dairy-free pudding, I suppose. She's able to back down the prednisone, and her gut feels better, and her energy is better. And this is the real bullet on the page, is that for the first time she feels better, not worse, and she has hope. And you know, she's our standard patient, and when I say ours, I mean our community, the person who's been everywhere and is expecting to be disappointed again. And so for the first time, she's seeing some real clinical change. So that's one piece. How well do you degrade histamine? But what about what's the cause of histamine? And IgG, immunoglobulin-mediated sensitivities, affect a lot of people. 100 million people, 50 million suffer from allergies, up to 50% of adults and 70% of children, and that food-related allergies can cause a variety of symptoms from skin to headaches to intestinal disease, and that these can be mediated by different immunoglobulins, IgE, IgG, IgA. We've pretty well become the experts at figuring out that there are different ways the immune system can react to foods, and that we need to consider all of them. And why is it such a big deal? Well, I think this visual helps us with that. If we pulled out the microvilli, if we pulled out the gut, the gut is 100 times the area of the skin or the size of a tennis court. So even if we're eating a little bit of irritant that is irritating something the size of a tennis court, it's going to impact us systemically. So this idea that what happens in the gut stays in the gut, and that has nothing to do with depression or arthritis or anxiety. I think we can make a compelling argument that the systems are connected. So how do we want to measure this? And well, what the research talks about is immunoglobulins are certainly immune triggers. There are 4 types, 1, 2, 3, and 4, some more inflammatory than others, but the most inflammatory reaction is when complement antigen, or in this case C3d, binds to the immunoglobulin. That's when you have the most vasculitis, so the most headaches, the most flushing, the most itching, the most symptoms. Conversely, another way of looking at this is if there's a therapy that can effectively decrease this type of inflammation, both complement and immunoglobulin, then you have a therapy that shuts off the most inflammatory reactions created by foods in the body. So there are different types out there. IgE, that's our immediate. Some tests do IgG4. That's only one way we react to foods. Then on the other side of the spectrum, a live cell analysis. That means some type of white blood cell got larger. And then the question is a white blood cell getting larger always correlated with a symptom? So I think on one hand, the IgG4, you could get some false negatives. On the other hand, size of the white blood cell, you might get some false positives. And then IgA, more of a local reaction in our gut, still important to consider. So Yes, there is research that talks about IgG being associated with symptoms, and this piece talks about exactly what we talk about when there are food sensitivities, more autoimmune conditions, more allergies, more cancer, and that certain, even IgG4 is higher in certain pathologies. And then here is another integral part of our story. What I've read about in the research is being defined as the meta-organism. And that meta-organism is that symbiotic relationship between us and the bacteria. If you boil down ourselves, you'll have 10 times the DNA from bacteria that you will have from humans. So some argue that we're more bugs than we are human. And I've also been really stimulated by this research, a term called inflammaging, that talks about conditions that we write off as being degenerative are not really our own aging process, but the aging of colonies in our gut, and how that milieu of flora changes, and when that changes certain conditions. So again, a real substantiation of how important something like a probiotic is in terms of changing pathology. And I was just having a conversation with Dr. Gravante this weekend, and we were talking about ProBio Plus, and we both said it's just easier now, that it just works so well. And the thing, so yes, it's 100 billion organisms. There are 200 billion organisms out there, 225 billion organisms out there, more organisms out there, but strain matters. Clinical response is strain specific. So we're going to look at some of the research between ProBio Plus, the Halobifida strain, HN109, 019, and if you go to PubMed and you limit by human trials, you're going to find a bunch of clinical data. You're going to find an N of 600 in children under 2 that this probiotic is tolerated by them and causes clinical response. You'll find another N of 100 in IBS, that it stops IBS symptoms. And again, time after time, you're going to see human trials of that specific strain stopping symptoms. And I would just have to agree with Dr. Gravante, that it does seem easier than it was. So here's the strain I'm talking about, the Bifidobacter lactis, HN019. You do the trial yourself. And again, strain specific. For example, some strains of Lactobacillus, specifically the ones that are in aged Swiss cheeses, create more histamine, whereas these guys are going to decrease your histamine. So the strain that you choose is important. And I want to give a little shout out to Saccharomyces. Don't forget that increases secretory IgA. I love the Saccharomyces DF by Zymogen. And look, it also improved activity of diamine oxidase. Saccharomyces decreased zonulin, this marker of leaky gut, goes up when there's more leaky gut, and it improved post-op recovery. This was with 150 patients, 75 in the Saccharomyces group, 75 in the control group, and again, what we saw in these people that had colon cancer, that they had better outcomes after surgery. And what about this, what concern that you shouldn't give a yeast to treat a yeast? Well, the research talks about not only does Saccharomyces compete with Candida, so it prevents adhesion, but look at the bottom line. It also reduces cytokine-mediated inflammatory host response. So you decrease the inflammation from Candida and you prevent it from adhering. Gut symptoms are ubiquitous and undertreated. This talks about how 42 to 69% of the population report at least some type of gut disorder, and that people don't go seek treatment. 75% of the people don't seek medical care. If we treat the gut, we stand to prevent autoimmune conditions, cancer, even diabetes. Think back to that leaky gut slide, or maybe I'm not there yet, for even type 2 diabetes. That is a new way for me to think about what leaky gut is affecting. Here we are, an extensive array of immune cells there in the gut. Over to the left, you see the T lymphocytes, and they're migrating out of the mucosa and back in. So this is where that openness of the tight junctions can cause more inflammation, or at least one more way it can. And kind of keep your eye on the ball. The bottom of this slide talks about when there's more inflammation, there's more TNF-alpha. I say that because we're going to see the treatments directly address TNF-alpha, this pro-inflammatory mediator that we know is higher, for example, in things like autism that respond well to treatments of the gut. And that protein, very anogenic. This talks about that there's as much as a half gram of undigested protein just floating around in our circulation every day. That's significant. And so this one, again, I just wanted to give a reminder that we can use things like vitamin A to not only increase secretory IgA, but to decrease immune inflammation, and that we can target the inflammatory trigger. And that is, we need to do things that stop the complement system, the most pro-inflammatory part. So we can change the milieu, we can improve gut flora, and that's going to change GI symptoms. This is specific to IBS. And if we can down-regulate complement, then that is the key, the bottom line there, to assessing food allergies and treating the most reactive part of it. So here's complement. Remember, here over to the left is the classic pathway of inflammation, and kind of in the middle up top, the alternate pathway that's activated, the complement cascade that gets activated. Over to the right is the host cell that then gets turned on, and then that's the cycle of inflammation that begins. So here's our patient. And they come in with weight gain, high blood pressure, and no energy. Probably the typical patient that most of us see. And for those of you that have run this food allergy test, a more typical presentation is 5 to 10 foods positive. They don't usually light up like a Christmas tree like this. I chose this patient because visually you can certainly see the difference. So he's gluten, he's casein, he's a mess. And recently I've undertaken the task of going through and looking at food sensitivities that look at complement as well as IgG, pulling 500 pre and post of these, reviewing the chart and seeing when people got better and when the food sensitivities got better, what was the commonality. And as I've begun to do this, I was really impressed by how many of these people who had dramatic change were on some level of the IgG 2000, the immunoglobulin. And it really made me stop to think about what is it that is doing that is so useful. So we've got all kinds of ways of getting it in, from the I5 to the IgG 2000. And again, if we can treat these 100 million people that have hidden allergy symptoms, we're also shutting off inflammation and think, what conditions are related to inflammation? It's hard to think of some that aren't. So again, the gut can create more of this TNF-alpha as well as other interleukins. And then this title is stolen from Fasano, that researcher that isolated zonulin. So he talks about living life on the edge of the wall, the physiologic, pathologic, and therapeutic implications of zonulin-mediated intestinal barrier modulation. What in the world does that mean? So, follow me. Over here on the left, we see gluten in the upper left corner, coming down, gliadin fragments, breaking off, binding to that pink receptor there. Gluten has the gliadin in there as well as other glutenoids that are also, that molecule of gluten has 60 different antigenic epitopes in it alone. It's not good stuff. It binds to that receptor, which signals the nucleus to then make zonulin. You see the red squiggles? That's the zonulin. Now that comes up and binds to the tissue. As one of the titles of his piece of research talks about, open sesame, boom, that causes tight junctions to open, things leak through intact, and that immune response is off to the races. Now, look over there on the left, that red IgG 2000. So when I was reading this, what I found out was that they're working on medications to block that CXCR3 that causes the release of zonulin that's responsible for the leaky gut. So, and you know what they're using to test the efficacy of those medications as a comparison? Non-specific immunoglobulins, because it blocks where gluten or some other antigen binds to trigger this zonulin-mediated gut intestinal barrier. So it's the same leaky gut we've always talked about, but we've isolated the pathology. You can measure the zonulin, and not only can you measure the zonulin, the research talks about leaky gut and tracked with zonulin going up 3 years before the onset of conditions like allergies, autoimmune conditions, cancer. What does that mean? That means that we have an effective tool for preventing things as devastating as autoimmune conditions and cancer, and it means that our theory that treating the gut has a widespread systemic effect was right on target. And probably this is not a way that you've thought about the IgG2000 working. We've thought about it surrounding bacteria, surrounding viruses, surrounding yeast to keep them from being reactive. We've thought about them, the immunoglobulins providing good amino acids to help build more immunoglobulins to help the immune system, but it blocks what zonulin would be doing to open that leaky gut. So when there's leaky gut, there's autoimmune conditions. Again, treat the gut, and you can change this. And I love his wording here. The new paradigm subverts traditional theories underlying the development of these diseases and suggests that these processes can be arrested if the interplay between genes and environmental triggers is prevented by reestablishing the zonulin-dependent intestinal barrier function. So again, we don't just have a genetic condition, but we can influence that expression by doing all of our good gut work, which is our OptiCleanse GHI. It has 1 gram of anti-inflammatories and 4 grams of glutamine to heal the gut. That is our ProBio Plus sachets that have the good Howie bifida, as well as the immunoglobulins, as well as the Saccharomyces. And that is our standalone ProBio Plus and our Saccharomyces. Again, I'll echo Dr. Gavanti in saying gut treatment's gotten easier because these things are so effective. And again, leaky gut and type 2 diabetes, the gut opens up, more oxidative stress, it damages not only the pancreas, but insulin receptors as well. Type 2 diabetes, treat the gut. It's going to help there too. That it's more than a filter, and that this is our lens to immune tolerance. The zonulin-dependent barrier is what decides, are we okay with the outside world, or is it something that we're going to react to? Don't forget that it's not just gluten, that bugs can also create, like they first discovered the zonulin with Vibrio cholera, and what they found was it was the toxin from that caused the release of this zonulin. We see that with other dysbiotic flora as well. And so that the diet, bugs, but also our ability to degrade histamine are going to determine the way that we're able to respond to the world at large. Our immune system, 85% of it is there in the gut, and the gut flora and these immunoglobulins become so important because in this world of antibiotic resistance, the immunoglobulins are somewhat akin to soap. So for example, soap doesn't kill things off, so you're not getting resistance with it, but it prevents adherence. So this piece kind of begs us to look for other strategies to deal with dysbiosis, and I think the immunoglobulins are a very effective answer to that. They reduce inflammation, they help protein assimilation, they help die-off reactions, so even in our most sensitive patients, we can get started on some of that very hard work. And when we use them over there to the right, you can see that they're very effective at neutralizing the epitopes from the different bugs. Also, more proteins were assimilated. Also, look over to the left. They decrease TNF-alpha and those interleukins, all the things that are the inflammatory mediators that we've mentioned that are made in the gut lining. This is a little hard to read, but basically, the smaller the number, the better, because that means the less of the type of immunoglobulin was necessary to neutralize the endotoxin. The IgG2000 is on the bottom there. You can see that was that it was able to get down to the smallest titration and still be effective. They work synergistically, and here's this beautiful balance of a well-proven bifido strain, Saccharomyces to improve its adherence, and immunoglobulins to help the immune system, and throw in some arabinogalactans. That is an oligosaccharide. It's a prebiotic. It helps the bifidobacter to adhere. It also decreases ammonia in the gut and increases secretory IgA in the gut. Now let's see. My slide stuck. Oh, okay, there we go. So this is the follow-up food sensitivity. You can see that it was much improved. And I wanted to put this in here too. Look at the upper part. It talks about gluten-free diets decreasing oxidized LDL. Why did I put this in here? Because again, as we treat the gut, even something like cardiovascular conditions can improve. Lower inflammation, lower oxidative stress. So the patient loses 33 pounds, their blood pressure improves, and they feel so much better. Here's a second patient, stomach issues, fatigue, elevated monocytes. Those go up on your CBC in response to allergies. They're lit up like a Christmas tree. And then we do the easy fiber. This person got the Mito kit. We did the S-acetylglutathione in them, OptiMag 125. In this case, during the OptiMetabolics, I think that this is a great choice with your Candida patients. You can lower blood sugar, rob the yeast of fuel, and some immunoglobulins. Again, that was the commonality in these really impressive responses. Look how the food allergies have cleared up. And again, so now when patients say, will I ever be able to eat that food again? No, not in excess, but with something like an immunoglobulin that's going to block, that's going to surround that antigen, even the food antigen, that's going to block that receptor. But we have a tool to help people have their energy go up, feel better, no gas and bloating. And look, even the monocytes came down into normal range. We're calming down complement, we're calming down immune IgG. This one is a professional athlete, and he came in with rash, and he'd used antibiotics, etc. And we have to be mindful of our athletes with the gut. And my supposition used to be, or was, that, well, I would see a lot of leaky gut in my athletes, and I thought, well, they must require higher levels of glutamine. The glutamine is necessary for the gut. They're robbing it from muscle mass, etc. And we can add to that now that our athletes will have higher levels of zonulin. But when they treated humans, not rats, with probiotics, what they saw was zonulin went down, i.e. Leaky gut went down, and markers of inflammation like TNF-alpha decreased after exercise. So again, less inflammation from that exercise, less overtraining impact. I've always thought that their adrenals are bottomed out, and so there's less cortisol, and so now these micro tears can't heal because there's less cortisol. Well, it turns out it's not just one pathway, but it's how all these things interact together. So that was his initial food allergy. Here's the follow-up. Again, you can just see how much better it is, and he feels good. He had no pain in his wrist. It was his best season ever, better energy, better recovery. And I will give one more shout out. He was on the Mito kit, like I said earlier. He loves that stuff. And from my people just doing kind of normal day-to-day exercise to the professional athletes makes a big difference. Again, things we would expect if the gut was off: migraines, IBS, and GERD. And this person, anxiety and depression. And so complement, C3D, one of those things that was measured in the food sensitivity test, complement's higher in depression. Again, inflammation causes depression. Our community has said this forever. If you treat the gut, well, I borrowed this from Dr. Hasse, a board member. He shared this slide. So if you treat the gut, you'll produce more serotonin there in the microvilli. From Dr. Hasse, I learned that serotonin, even in the gut, has to be methylated into melatonin, and that there's 400 times the melatonin in the gut than there is in the pineal gland. And so again, if we have someone who has a sensitive gut, they get more nervous. That can sometimes be too much serotonin. Methylate it. Turn it into melatonin. That should help. Another clinical trick, actually lysine competes with serotonin in the gut. So for a nervous stomach, someone who gets diarrhea when they have things that are, when they're more nervous excitement or just upset, that's a nice treatment as well. So her food allergies get a lot better, less severe reactions, and she's able to come off her Cymbalta. She's not having migraines, and she doesn't have IBS unless she eats the foods that she knows she's sensitive to, and then she has her symptoms again. But at least she has control over what she's doing that way. And then this is the last case study. It's just so obvious to me that a part of osteoporosis ought to be treating the gut. We want people to absorb more minerals. And so here she's lit up. Now, look how much better. GERD's gone, improvement on DEXA, and she was on the Osiplex the packets, one twice a day, and that was a key part of her therapy. But again, think back to the alternative, people on these antacids, and that causes more food allergies, and the H2 blockers can inhibit diamine oxidase, and now you have a gut that's a wreck. You're never going to regain, for example, 9% bone density like a lot of my patients that are on Osiplex do. So we think of these conditions, but the bottom bullet, any condition that's affected by inflammation is an appropriate time to use Histoblock, to use our high-quality researched probiotics, to use I5, which has the immunoglobulins, or IgG2000, and to be able to put these things together in a really successful way that addresses all parts of the puzzle, the bugs, the foods, and the overproduction of histamine. And I'll stop there.
Wow, that was fantastic. Thanks so much, Dr. Burdett. We have a lot of questions here, quite a few people still on the line. So do you mind going through some of these questions?
Not at all.
Okay. Let's see here. So, you brought up a really important point about zonulin and then the immunoglobulins, and there's some questions that were raised about, the IgG component linking with zonulin and gluten activating zonulin. Can you kind of go through that one more time? There's a couple questions on that.
Yeah. So Fasano, who originally isolated zonulin, what he found is that the structure between zonulin, which then comes up, binds to the gut, and opens up the tight junctions, he found that the structure of zonulin was very similar to the structure of immunoglobulin. And so I thought that I could unravel this entire mystery by, looking at immunoglobulin therapy. We've done this for years. We've done it IV. So there ought to be some really defined mechanisms. And as the double standard it often is, you go look up IV immunoglobulins and it says mechanism is not entirely defined. But if you keep digging, one of the things I found is that higher levels of nonspecific immunoglobulins turns that immune system back to regulating more. And that makes sense. If cells see a lot of immunoglobulins, they say the problem's being solved, the bacteria is being walled off, we can calm our immune response down. That's part of it. But another part is that immunoglobulin is able to just block the gluten or the gliadin from binding to that receptor in the first place that causes the release of insulin. It's an agonist, no antagonist.
That's really interesting stuff. And you brought up, diabetes, and I think we shared this article on the email string a couple months ago, but I think it was May of 2012, there was an article that showed that increased zonulin signaling, meaning, increased leaky gut, is associated with body mass index and waist circumference and diabetes. So I think that was maybe one of the articles that you were sharing. So, incidentally, there's some other research showing that obese individuals tend to have reduced DAO, diamine oxygenase, the enzyme that breaks down histamine. They have reduced levels of that in their intestines. So there may be, another link there with, you were talking about the prediabetes and diabetes and metabolic syndrome.
That's fascinating. And I mean, again, our community has been a champion of treat the gut and many things will fall into place. And just like you're saying, from obesity to type 2 diabetes, treating the gut has a role.
But yeah, it's huge. Yeah, there's so much research in that realm. And we have a bunch more questions, but before we get going into those questions, just want to remind everyone on the special we run, we're doing something a little bit different. This runs till Monday, but what we're offering here, if you order, any of these products, buy 6 get 1 free, buy 12 get 3 free. If you order by Friday, we're throwing in a product it's an add-on bonus, if you will, of Diovasc, which is a new flavonoid extract. It's a micronized diosmin asparaginase combination that has some really fascinating research on vein integrity and some aspects related to diabetic ulcers and the feet and hemorrhoids, and a lot of really interesting research. So again, if you order by Friday, you can take advantage of that special we're doing and get a free bottle of Diovasc. So just want to remind you guys of that. And then next week, we have a Dr. Dawn Brown that's going to be doing a webinar for us on some new aspects of female hormone challenges and the overlap between female hormone imbalances and cardiovascular disease. So that'll be a really fascinating webinar next Wednesday night on the 30th. And then on the 6th, we have February 6th, Ryan Frace and Seth Adams going through some really cool research on the top 12 vitamin Gym products. So with that, let's go through a couple questions here. So people are asking about the availability, Dr. Burdett, of DAO testing. Can you speak to that?
Yes, there are a number of labs that do it. My lab does it, NutriTest, and I just saw somebody else, shoot, I'm not going to remember the name of the lab, but there are other people that do it too. That profile that you saw is the one NutriTest does, and it has diamine oxidase histamine and that ratio. Look for two people that are friends of Zymogen. I'm also looking at bundling stool culture, the complement and the IgG food sensitivity with the diamine oxidase and zonulin, and I think that I'm going to be able to put that together at a really competitive price, because I really believe that that is the triad of treating the gut, and people, and it moves things along more quickly.
Mm-hmm. And so your website, the website to get more information is just NutriTest spelled out? Is that...
Yes, NutriTestLabs.com.
NutriTest Lab, okay. Awesome. Well, we're going to send up a follow-up email for everyone that's participating, so you guys will get that information. Let's see here. Genetic polymorphisms, I know there's some SNPs involved in reduced DAO activity. Do you have any other comments on that?
And I mentioned it in terms of TNF-alpha, but you see SNPs like that, for example, those have been associated with autism as well. So this kind of speaks to why, with a lot of times with your autistic kiddos, you get them on a nice clean diet, all the gluten is gone, all the dairy is gone, you're doing what the tests say, but they still have those really loose stools or foul smelling, or they just continue to have some gut problems because, again, it's not just the irritant, but it's also the ability to degrade it, and I think autism is a magnified example of that.
Mm-hmm. Interesting. Okay. There's a couple questions on the potential of DAO or the HIT-DAO product being applicable for eosinophil-mediated inflammation, in children, like esophagitis and things of that sort. Do you have any clinical experience in that realm?
I have treated a few cases. I can't say I've treated a ton, but the last one, esophageal eosinophil esophagitis, the last one that came in was actually, I guess, a good teaching case because she had pre and post biopsy. And so clinically, we did OptiCleanse GHI, ProBio Plus, and some of the immunoglobulins. She felt better. She felt less inflamed. Her symptoms were improved, and the biopsy was improved as well. I think that it would be appropriate to use, but I just think that you would probably be surrounding it with a multitude of therapies, just like we always do. You would be thinking about good fish oils. You'd be thinking about vitamin C to get rid of more histamine. You'd be thinking about whatever was causing those eosinophils to be high in the first place. What's the trigger? And certainly we're not talking about using this in place of, in terms of not esophageal eosinophil esophagitis, but otherwise we're not talking about using DAO in place of an EpiPen, obviously. But I do think that it can acutely calm down inflammation. And for example, I'll have patients use 4 of the DAO kind of like you would a Benadryl. If they take 4 all at once, really calms down an allergic reaction and doesn't make them groggy.
Mm-hmm, mm-hmm. And that's an important component to discuss. Everyone always wants to know the speed at which things work, whether it's quercetin or probiotics, whatever. And it's been our experience, and we'd love to hear your comments at how quickly this product can work for certain people. You want to speak to that? It's not one of these things where you have to take 3 bottles and then reevaluate. I mean, we see pretty rapid results. You want to talk about that?
Yeah, I agree with you that it is, and so I'll use it a little more aggressively initially, but then you're able to taper down. It's just like inflammation in general. Once you break that cycle of inflammation, much easier to keep it down than it is to turn it off. But again, and we'll think back to Ryan's story with the kiddo taking 4 capsules twice a day. And of course, one of the questions those parents are going to ask are, does my kid have to take 4 capsules twice a day for the rest of her life? In this case, they didn't care because they'd gotten such a good clinical difference with that kid. They said, whatever it takes. But in general, and we're going to have people that are not quite as dramatic as she is. And if we break the cycle of inflammation quickly and they feel better initially, now they come back in, they're willing to do the more, kind of like building a muscle, building the gut, building the adrenals. They're willing to do more of that long-term work because they saw immediate improvement. I'll quote Eve Plews, another board member, who talks about you create a window of time. Like if you can do something that changes that person, you create this window where now they're more receptive to the whole story.
Mm-hmm. Yeah, that's it. And along those lines, future costs, and people are just worried about, oh my gosh, I'm going to be taking this thing forever, and you're just, alluding to that. And so is this one of these things where, practitioners always question, am I going to have to be on this forever? But you were just kind of alluding to the fact that, you can, restore homeostasis if you're willing to gut it and rebuild the muscle. So what are you finding? I mean, are people using this for a month, 2 months, and then tapering down? I mean, what are your, if someone walks in, they're multiple food sensitivities, leaky gut, all that, I mean, what would be your kind of standard protocol, if you will?
I think in your worst case scenarios, you're talking about a good, aggressive 6 months to a year of gut work, not necessarily DAO that entire time, but more normally somewhere between 1 to 3, 3 to 6, kind of 1 to 3 mild, 3 to 6 months moderate, more than that severe. And so an example of a way to start would be something like the DAO. I would have said 2 twice a day, but now because of being intellectually challenged from the board, I would now say it might be more effective to do something like 1 with breakfast, 1 with lunch, 2 with dinner. Alongside doing that, you're doing your OptiCleanse GHI or your I5. I can make an argument for each in terms of building up the gut. And then you're doing the matrix of functional medicine. You're removing the food sensitivities, using our probiotics. And then I would say probably at a 1 to 3 month time, as their symptoms get better, you're able to and I left out enzymes, and that was an oversight. But you're able to start backing down the diamine oxidase. At that point, you might have them even just do 1 with a large meal. And then I say, if you're exposed to something that is on your sensitivity list, if you're going out to eat and you know it's risky, then take 1 to 2 when you do that so that you can just prevent the histamine-related inflammation to the gut. And or if you're going into an allergy season that's very bad for you, then bring it back on board while there's just more of a histamine load on your body. And then when you get through that fall allergy season or that spring allergy season, you'll be able to back it down again. So use it more aggressively initially. 4 is a high dose because it's very effective. Probably more like 1 twice a day is often enough. And then back it down and ramp it up if there's an acute exposure or if there's more histamine exposure from environmental triggers.
Mm-hmm. Nice. Okay. We'll summarize that for you guys. I know it's a lot of information, but we'll send out a follow-up email, and this will be recording. Let's see here. There's just one more question that some people did ask. Okay, what would you repeat your pre-probiotic protocol for a 3-year-old that has been on lifelong antibiotic therapy?
Okay. So this speaks to the Hallie bifida species. In a little kiddo, I want to make sure that I'm using something that is, of course, effective but safe. And there's a picture that Scott Bucco, who's in charge of international sales, shows, and it's this poor little bitty baby, I'm going to say about 3 months, and the belly just distended and swollen. It looks terrible. They do the ProBio Plus, and then that belly resolves. Now say again, how old was the kiddo too?
Sorry, I don't mean to interrupt you, but that was actually a doctor that I worked with, Dr. Teaver, and it's fascinating. Yeah, so I sent that out to everyone. But yeah, so there's really great story. So I just want to jump in here, then we can get back to that. But it was fascinating. I mean, they did Dr. Burdett, they did 400 billion CFUs per day. So it's a ProBiomax DF, which, as you all know, has 100 billion CFUs per cap, and they emptied the caps into some of the mother's breast milk and administer it that way. So, but it's remarkable this feedback. I mean, the patients, this kid was not on antibiotics. It's kind of this idiopathic, real bad bloating, and really rapid results, and the parents were just really excited. I mean, that was one of the best feedback I've ever seen since I've been doing this with probiotics. But interesting. But yeah, so this particular question from a Brenda Spencer was asking about a 2-year-old, and
Okay.
how long would you be cranking the probiotics, basically?
Okay, so unfortunately, not too many people, and especially 2-year-olds, don't love blood draws. But in a case like that, where it's sometimes harder to take a history, how many bowel movements are you having a day, and how much gas and bloating, and etc. Now, absolutely, that mom will know if they're eating more and their appetite is better, and they're less often saying my tummy hurts. So I would not at all say you're not going to get information from a clinical history. But this is a case where you could use something like use the ProBio Plus, and then measure something like zonulin and DAO to make sure that zonulin's down and DAO is up as markers of gut integrity. That wouldn't be the only way to do it. You could get that information to some degree from a stool culture, looking at things like short-chain fatty acids, or either a reintroduction of foods that they were sensitive to as a challenge, or potentially a follow-up food allergy test. Now, again, all that aside, 95% information from a clinical history based on symptoms, how they're doing. But in a 2-year-old, I don't use the entire capsule. I'll open it up and use part of the capsule, like a half of the capsule. And this one works really quickly. So even in adults, I find that one a day, after those first 30 days of the ProBio Plus the up, that most patients are ready to back it down. And so they'll do one a day for one box, and now I'm talking adults. And then, based on how they're doing, when they come back in, I might have them repeat the course, or often I'll go to 1 3 times a week, and then even just one a week. In the 2-year-old, I would expect that you could do a half capsule a day for a month to 3 months, depending on how they are, but pretty quickly by month 2 to 4, starting to do that every other day or even less and less. Kiddos tend to respond pretty quickly.
Yeah. And the important thing to point out, I mean, these strains are very safe. They've been tested, by TNISCO and
right.
very clean.
Yeah, and this is one of the few times we get to say in a population of 2 and under, there's a study with 600 of them. So we have this high degree of safety.
Right. Yeah, so no concern there. Someone did have, the 2 more questions. On the Saccharomyces boulardii, do you worry about introducing that, for children? Is there an age, where you don't want to start introducing that, or what's your thoughts on that?
I do think with any probiotic that you want to be careful when the gut's not healed. And so I don't tend to do a lot of probiotics in an infant or 3 months or 6 months. I like to wait. In the worst case scenarios, where that seems really indicated, the very low dose, and I'll often have that done by, for example, the mother putting a little bit of probiotic on her nipple when she does breastfeeding. But you do have to be careful of probiotics when that brand new gut comes out, because it's still permeable. So you do want to be careful. So I try to hold off any kind of probiotics until we reach an age where there's more gut integrity, and so I think of that as when we would think it's safe to introduce food, that's when it becomes more safe to introduce probiotics. And otherwise, if we can do things like really feed the mother's gut before birth as we go through the vaginal canal, that's where we get seeded with our good flora, so that will help baby come out with their own good flora, and then again using very minimal amounts. But even if I have mom take the probiotic, some of this immune response, some of what then happens, some of the immune modulating compounds that will then be passed through colostrum or breast milk are improved, and that's a very safe way of doing it.
The last question, Dr. Burdett, is for people that have antibodies against baker's yeast. like Saccharomyces cerevisiae and stuff. How do you feel about giving them the Blardi? Are you okay with that?
Well, and that's why I wanted to include that piece about the Candida in there. The beneficial yeast competes with the pathogenic yeast. And then if you go on to do some of that reading, it's very interesting. The things that we've evolved with, like the Saccharomyces, help the good flora to adhere more to, but then they prevent adherence of the bad flora. That same story is true with, for example, digestive enzymes. Because our good flora has evolved for thousands and thousands of years with digestive enzymes, good levels of digestive enzymes favor the good flora and do not favor dysbiotic flora. So you've always got to individualize, and someone that's super yeast sensitive, you might not be able to use it, but I do think in general it will compete there and prevent adherence, and that's why I shared that piece of Candida research.
Okay. Wow. Well, thanks so much, Dr. Burdett. This was great information, and we really appreciate you doing this, and appreciate all you guys joining us on these webinars. I know it's hard to get away from family and all that, but we appreciate that. So hope you have a great evening, and we'll see you next week if you tune in for the webinar with Dr. Brown. All right. Have a good one, Dr. Burdett.
Yeah, you too, Mike.
Okay.